Hello, health heroes from This Is Our Shot and Vacunate Ya. I'm Erica Montes, a board-certified obstetrician and gynecologist, and I'm happy to be here talking to you today about 3 groups that I see on a daily basis and how to discuss the COVID-19 vaccine with them. Those groups would include pregnant individuals, individuals that are breastfeeding, and also individuals who are trying to conceive in the future. There's a few points that I do tend to make sure my pregnant individuals know, so that way they can make an informed decision about whether or not they should get vaccinated. The first point is that even though pregnant individuals are younger and healthier for the most part, we still see a pretty high risk in severe disease in pregnant moms, and also a higher risk of needing ICU admissions and intubation and even death. Since May of 2021, about 58,000 pregnant individuals in the United States have been infected with COVID-19, and of those, 71 have passed from the infection. The second point that I try to make with pregnant individuals is that, as far as the vaccine trials go, we know that they weren't included in the initial studies, but we're actually collecting observational data, and the New England Journal of Medicine just in April was able to collect data from 35,000 pregnant people, and basically what they saw is that they don't see any safety concerns, and the Moderna and Pfizer vaccine do appear to be safe, so that is promising. As far as breastfeeding individuals go, because I do see more vaccine hesitancy with my pregnant patients, I feel as though the individuals who are breastfeeding are likely more open to vaccination during the postpartum period. But then there poses the question, is the vaccine safe to get during breastfeeding? So overall, we know that vaccines can be safe during breastfeeding. The World Health Organization does recommend the use of vaccination during breastfeeding, and recommends that breastfeeding should not be discontinued due to vaccination. And also, it's important for patients to remember that antibodies have been found in the breast milk, and that potentially can provide immunity to their babies. The final group that I'll refer to are individuals that are trying to conceive. This group can be a little tricky because there has been so much misinformation on social media regarding COVID-19 vaccination and infertility. ACOG, or my American College of Obstetrics and Gynecology, does not recommend delaying vaccination if you are trying to conceive in the future. They also recommend to continue your same scheduling regimen even if you happen to become or are known to become pregnant after the first dose. And patients should not be required to provide a urine pregnancy test prior to vaccination. We also want patients to realize that there have actually been studies comparing women who have been vaccinated and not vaccinated, and we're not seeing any difference in hormone production, ovarian reserve, or even ovarian function, or how well our ovaries ovulate. The risk of miscarriage and stillbirth is right at the general population risk. It's important for us to remember that the goal of vaccination is to preserve the health of individual patients as well as the health of the general population.